So this is 3 of massage manipulations and techniques, and we have built ourselves a client here to show the various methods. There's 9 methods and 12 modifiers. So just to explain our demo.
Our creation here.
Yeah, and with some of us teaching remote, it's nice to have options.
Yes, so you just can build a body out of pillows and foam. I mean, you got a weight ball here.
Head.
Rolled toilet paper for her neck. And then block of foam here for the torso. An arm and a leg. So.
And these are squishy.
Yes.
And so they'll mimic tissue deformation.
And for the covering is typically on the bolsters, lends itself not perfectly by any means, but to getting a sense of when we talk about drag.
Yes.
Like how much drag do I get on the tissue with no lotion versus more lotion?
So this is our client, and we're just going to talk about the various methods, and I'm going to use the various methods on various parts of the body. You're concentrating on where my hands and forearm is at for this. We would refer back to the biomechanics video. Obviously, when we do actual demos, they'll be able to see it in its totality.
But go and look at the forearm first video and especially the biomechanics.
Yes.
So biomechanics and
we have positioning.
Positioning.
Yes. So this person is, let's pretend this person is prone.
Mm-hmm. So she's already there, but the first method is static methods / holding. In the context of the session, this is usually our initial contact with the client. It can be used as a component in, just part of our sequence. It can be an assessment tool of gauging maybe the heat of an area.
And you can use it as a transition method. Mm-hmm. So
absolutely. So it can be your first method in an area. One to just make contact, potentially assessment, always assessment, I should say.
Mm-hmm.
Then I will introduce more methods, such as gliding, kneading, and then at the end of it, maybe end with a hold and transition to the next and continue. So it can give you, especially starting out, a good beginning and ending. Helps bookend the in-between.
Yes. So if I'm here on the back and I want to head towards the cervical area, start, put everything else in the middle, mm-hmm. and so I can put my hands here, then I can move this hand up and touch here, and then I can move this hand and touch here. Mm-hmm. Come around, this would be shoulders, head again, come into the arm, do what I'm going to do, transition, so that there's always a level of contact. Now you can lift your hands up off the client.
There have been some issues with, in the field of saying that you could never disengage, and there are points at which it's just not ergonomically feasible. I have to move the bolsters.
That's right.
I maybe have to make sure I'm anchoring and holding the sheets effectively. I have to get my lotion, sanitizer, things like that. But optimally, yes, I'm making contact, helping. There's a security component here as well, and that the client knows where you are.
This holding, this initial touch, one of the big components about it is it doesn't move, it's still. And so it can be modified by how long you stay in the spot, how deep the compressive force is with the holding, whether you combine another load with it, like hold first and then maybe rock. Mm-hmm. So we can't ever not hold.
Right. That's always going to be a part of our initial making contact with the tissue.
Yep.
So then, next we have compression.
So compression's holding.
But
It's got a little bit more push to it.
more pressure.
Yeah, to create more pressure. So you're going to actually noticeably see the tissue change shape.
Mm-hmm.
So if I were going to do compression here, I could light, medium, a little firmer. You can see that over here, whether I use a hand. I change that or modify that with the intensity, the depth, there's no movement to it, so there's no drag component.
But then the rhythm becomes a piece of this too. So just as she was indicating, maybe there being a sequence in terms of the holding, there also can be a sequence or a pacing and rhythm, speed to the compression. It can be so here's my compression, back out, contact, compression, and that can be the sequence.
Well, and because there is always a compressive element, every method pretty much is going to start out with compression.
You basically have a hold that transitions into a compression, and then I may apply another component. If there's more lotion or a lubricant, oil, I will then be able to shift into a glide. But you don't want to try to come in like an airplane and glide.
No.
That's not mechanically feasible. It's bad biomechanics. You start with a compression, sink into the right tissue layer, depending on how much pressure I'm thinking about, what layer of tissue I'm most affecting, and then I will apply an additional force. And depending on that, as we talk about other stressors, I may be getting a tension stress by including that as well. So we start with our compression, just creating the compression stress, and then if I were going into a glide, now we've moved into creating that tension. But it starts with compression. Almost every single technique and method starts with compression.
So then what's our next
It
one?
goes right to gliding.
Gliding. So what's really annoying with gliding is a stroke. It travels, there's an excursion to it. But I see this all the time. People start with a kind of a light contact, a hold, and then instead of maintaining a level of continuity with their compression to get their pressure, all of a sudden, as they need to move, but if they come up over top of it, all of a sudden it's too much. So the glide, so you contact, get your area, then you apply your compression to the intensity that you're after. And then your excursion, like we talked about in the body mechanics video, is just what your legs will allow you to do.
And what you're going to find, the most effective body mechanics that allows for this method application, it's going to seem maybe like smaller glides, smaller excursions than you are used to. People will attempt to do a lot of big, long glides, whereas part of that rhythmic process that I showed with the compression can also be utilized with the glide. It just ends up looking like a compression plus the glide, but it's a relatively short distance. It's a short excursion. Small one, I transition out and I move right back into a compression, glide, come back out, compression, glide. Now, that rhythm it maintains what we talk about flow and pacing. It will feel good, but don't get stuck in trying to do these super long glides. That takes your body, and usually you end up twisting. You
You're
lose
out of
your
neutral,
leverage.
way over out of neutral position.
So smaller glides.
Now gliding is one of the main, it's easy to do with your body mechanics. It is one that benefits from having a lubricant.
Yes.
The holding, it's not necessary. compression is not necessary.
Mm-hmm.
But now with the glide, we can determine how much drag there is.
And better to start with too little
Yes.
lotion and then add as you need. So
Oh.
if we bring this in, we're just including this as part of the back.
No, I think that this person's hypermobile and they got their leg
The
out
leg
here.
went all the way back there, they folded over. Be very impressive. So, if I have no lotion, and that would give me the most amount of drag.
Yes.
This usually is associated with ideas of myofascial and the connective tissue
Yes.
therapies. But what I'm looking at here now, this hand is gripping. Potentially, their body would not move out of, would not roll away from me.
That's right.
But this is anchoring. This is my working hand, and with no lotion, I can get a pretty good tension. You can see the distortion here. Now, this is the uncomfortable part of it, is if we reach a point where I'm attempting to apply a tension force to the tissue, but then I end up doing kind of that quick stuttering slip. So I would prefer to have maybe the ability to glide slowly, but one with maybe a little less drag, but not too much. If I reach a point where I can't make contact with the tissue, I'm not going to create as much of a tension.
No, and then
I'll just end up sliding. And it's hard for me by my body mechanics because it's much easier for me to inadvertently fall out of neutral.
well, and you're also going to have problems controlling your speed.
Mm-hmm.
You're going to have problems with your depth.
So I start with maybe this potentially would be even too much.
Yeah.
But we're talking just, a little blip, like about the size of
Pea.
or finger pad. So if I apply the lotion,
Which is using a gliding.
yep, and so that can become part of it, part of the experience.
Yes.
I'll call it flourishes. If I'm going to throw in, sometimes people make this the whole massage.
Ugh.
That is usually for me just getting the lotion on, and I'll make
And
it.
there's a place for lotioning.
Yes, and I'll make it feel good and have a flow and some prettiness to it and everything. Now I move into being able to.
Now you can control that.
But I am not slipping. I am
No,
able
you're
to.
still getting that pull in between.
But I have the slow effect where now I'm creating a tension force across the whole excursion.
Well, and look at this tissue is crawling in front of
Mhm.
you too, so that's creating its own sensation. It's creating almost a lifting.
Now, people will ask with this, what we were demonstrating with chopping one glide into many, they'll think that it's going to be very choppy.
It isn't though.
But if we watch, so you might not be able to see my legs very effectively. I am gliding, and then I'm just taking a step. My pressure maybe comes back a little bit, but I can maintain that contact pretty effectively. Step, glide,
Now do that with your forearm.
step. Yeah, I might need a little more lotion here.
See, you can always put lotion on. If you get too much on,
Mhm.
then what you got to do is wipe it off.
Exactly, and you just use the sheet.
Yep.
So, here we go. I'm gonna need. It's a case where.
Well, your arms are hairy.
Yes, and that can be a factor.
Yes.
Um,
Mine are not. See,
and
watch.
even adapting to a client's body, somebody that has.
Well, I still would use a little bit more.
You're right. So there we go.
That's the way it's supposed to be.
You see, they're small glides, but I don't break contact. I'm not doing this and then coming completely back and then starting again like that. I glide, get to the end, my forearm stays in contact with them, and I just take a step and start over again.
Now, a glide, typically we think of these glides going up and down, but glides could better if they kind of go across and on diagonal.
Absolutely. You are potentially affecting the muscle cells, muscle fibers more effectively. If you go on an angle to those fibers, you will get some tension and some bending.
What? See, I can do it. I gotta have some motion though.
So,
All right, ready? Hold it.
yep.
So, not always up and down. In
No.
fact, better on a diagonal or a cross.
Mm-hmm.
So if I'm coming, this is a joint.
Yep.
This is a joint, and I'm coming across it. See, now I'm getting the bending
Mm-hmm.
with the compression. Plus, I'm getting tension at the attachment
Yeah.
areas. Then I can just come back, add a nice little pull.
Yep.
Make it nice.
Yeah.
All right, what's the next one?
Now we're moving on to torsion. So kneading, twisting.
We saw that in the last one, but if you
Yes.
want to demonstrate that
We'll do that
again.
real quick again. Very simple. This is a great example where people if you have too much lotion or oil, you're going to be slipping and you end up staying very superficial.
That's
so I end up
right.
doing a lot of this. This is too hard on me and it's simply not accomplishing a lot. Slow it down, make it bigger. Start just like you would with the glide. It starts with a compression, right? So it's a push, pin. This becomes a static compression. I am just holding this for now. This hand is coming around, getting a hold of the tissue so that I can pull that into me. And what's happening at my legs is I'm shifting actually the knee that's bent and using my body weight. I don't know if it'll be very easy. You won't be able to see your legs. So.
Oh, well, we'll show you.
She's trying to show the knees, but that's okay. So anyway, push and pull.
And there's no glide, there's no slip.
Pull.
You're carrying the tissue
Yes.
around with you.
Let me actually confirm. I have to see if we can see the legs, and I'll demonstrate that. The next after that would be shearing.
All right, so shearing, we've done that. That's a back and forth.
Right.
It's usually in a small area,
Mm-hmm.
and it's usually an intervention.
Right.
So the key is that you make enough. Here's your hold. Here's your compression. Now you go back and forth enough so that you're creating a friction.
Mm-hmm.
Or here's your hold. Here's your compression, and then you move back and forth, and there's your.
And that's the most common area for that is usually related to connective tissue related issues. Scar tissue is the classic example, but you do see these types of interventions used in some of the tool-based therapies like Graston and A-stim, and I have personally seen that utilized more with like a tendonitis,
Yeah.
like a fibrosis, tendinosis scenario where the issue seems to be connective tissue, ligament, tendon related, and introducing the controlled inflammation will hopefully get whatever is occurring to resolve. But it is an aggressive technique, and you're better doing a little too little than a little too much. Anyway,
What's next?
we are on to elongation.
Ooh.
So elongation,
You hold
Can
on.
be
Let's
done
do this one. Let's
multiple
put his
ways.
leg back. Bring the arm up.
we noted that many times during gliding, we're creating some elongation.
Absolutely, especially if you make that stable when you do it.
Mm-hmm.
So
And a bend as well. If something is bending, the side that's being pushed may be like where my compressive force is, but that whole outside part, that's actually elongating. That side of the bolster of this arm is being elongated. So we have to think that sometimes certain methods will still create these effects.
now, if you've got too much lotion, it's too hard to get the elongation here because you slip.
Right.
You know, and you kind of want that to occur.
And the classic example again is with myofascial connective tissue therapy. We want that superficial fascia to be moving. You could argue the same thing even with lymphatic drain. You have to be able to move the superficial fascia enough to cause the lymphatic ducts to actually
To open up a little
be
bit.
to be able to shift. So too much lotion, you're not getting enough grip on the skin to elongate the superficial fascia. This also could be done with joint movement. If this is a bent joint,
There's your elongation, there's your compression.
and now this is elongated.
So all of your stretching is elongated.
All of your stretching,
So
all
what's
of your
the
included
stretch?
joint movement.
How would you, this is, okay,
Or
so,
it could be one way versus the other. Yeah.
Yeah.
But one side is being stretched. What were you gonna say?
Oh, I was gonna say on a joint movement, let's pretend this is the knee.
Mm-hmm.
Let's turn them over
Mhm.
so that they're face down.
Posterior knee or anterior?
That's a posterior knee.
Right here's the posterior knee.
Yeah.
Okay.
And I want to maybe get some elongation into the quadriceps. This is the hip down here.
So, forgive, there's some dyslexia.
Oh, did I do that backwards?
Yes. So, if posterior knee, this would be hamstrings and calves. Right?
Yes.
So, if we're thinking maybe hamstrings, is that what we were thinking?
Yeah, but
about?
that's not stretching hamstrings. That's
But if we did this,
that's stretching hamstrings.
yes, I might apply a compressive force of pin and stretch ideas. But really, I apply a compressive force while the knee is in flexion, and then I take it into extension. Now, you flip that around, what she was
Yes.
saying, and we're talking quadriceps. Here's the kneecap, here's
Yeah,
the patella,
you're right.
and here's the quadricep. I am here only to help clarify.
Now I'm
You wanna
stretching
go back?
hamstrings.
Yes.
Yeah, but you know what? Probably don't need to do that very much.
No, some therapists, massage therapists, particularly with sports outcomes, will tend to overstretch.
Yeah.
We're better at working on muscle tone and connective tissue density, and we don't want to make the ligaments and tendons longer.
Yeah, hypermobility is a real issue.
So moving on, we got oscillation.
Ooh.
Now that can be done
I do that a lot. That's a transition stroke for
rhythmically
me.
and small,
Yeah.
which is usually labeled as rocking. Which, yeah, she's saying she includes it with the hold.
Yeah.
Hold with a little oscillation, nothing big, just kind of that soothing, rocking, helps move you from one area to the other. But if you go at a higher intensity,
Okay, so arm.
mm-hmm.
I'm the shoulder joint.
Mm-hmm.
You're gonna traction.
Yeah, I'm creating a traction. So maybe I'm holding at the wrist.
So this is an elongation.
Yep.
Now add shape. Now there's a lot happening up here with me,
Mhm.
right?
Right.
So you're getting mechanoreceptors in the joint when you do that.
Mm-hmm.
Now, what if you shook it around an arc?
Kind of.
Yeah, go.
Oh, and just go away.
So that's even adding another
see how much
component
more.
to it.
Because now we're getting it changes the shape, elongation and shortening up there as I go. So maybe I'm going AB ducting and AD ducting
Yes.
as I do this. Yes.
And I'm up here going like this.
Mm-hmm.
Now, the other way you can do it is to shake the tissue in between the joint.
Mm-hmm.
So, you,
If I hold.
all right, and it's,
So maybe this is our femur and she's shaking the hamstrings.
Yeah.
And
Or the
trying to
calf.
and trying to just get this to move. It can be an assessment technique. Because as I'm feeling this with my hand and I'm even looking at it, am I seeing the tissue move evenly? You can even use it across the whole body. We've done that where just a general rocking of the torso. I may see parts of the spine that don't move. If somebody maybe has low back issues, I might rock the torso and I see that their ribs and hips all move together.
and that would be an indication that we're not having segmental adaptation correctly.
Mm-hmm.
So all of these methods, which is going to be future video, you got to know how to use the spoon in order to make the cookies.
Right.
You know, so, but all of these become ways that we assess and then construct interventions.
And I think that brings up a good point in that these are methods, but we don't want to lose perception of that. That
That's right.
assessment is something we can always be doing. Our initial contact is assessment.
Yep.
And then our last contact is a post-assessment. So, okay. Going into percussion.
Ah!
You're tapping. This can just use plenty. It can be, and as you see, she's using different parts of her body to accomplish this. Maybe it has to do with where she is on the body, and so it can be like a chop. It can be using a fist. It can be using cupping.
Now, to be perfectly honest with you, and I've been doing massage for a long time, I don't use friction or the shearing, and I don't use the percussive stuff very much. I use oscillation a lot.
Mm-hmm.
Not vibration because it's too hard to do,
Mm-hmm.
but I use the rocking and the shaking a lot.
Mm-hmm.
But there are times when I will use the percussion.
Mm-hmm.
One time is over the chest area here and on
Or
the
the back
back.
of the thorax. Maybe they've had some upper respiratory issues.
If there's a joint that just seems not responsive, sometimes I'll give it a,
Mm-hmm.
and that will kick up some of the nervous system with it.
Same that could be with an inhibited muscle.
Yes.
A certain
Give it
muscle is not
it's like saying,
is not
wake up.
firing effectively. So you're trying to you're giving the nervous system a stimulus to say, hey, send some energy, some information here. The classic example, firing pattern sequences. We maybe want vastus medialis to fire more effectively during knee extension. So maybe while they're performing knee extension, I could tap on that specific muscle. There are times, but for the most part, we work better in thinking of where is the tissue too short, and I will save my energy in focusing at decreasing the tension of tissue that's too short, and not using these more aggressive and actually uncomfortable
and
effects.
tiny, where they focus tiny. Now you see this. There's commercials about massage and stuff on TV now.
Mm-hmm.
You almost always see this
Right.
as part of it. But in reality, it's not necessarily used as much as some would think. And just because you can doesn't mean you have to include it.
Certainly. Now, it can be a question you ask your client. What are some experiences that you've really appreciated during your prior massage sessions? Do you enjoy tapotment up and down the back? They may have experienced that with another therapist and do enjoy it, or they don't, but us asking that question helps a lot. Sometimes it's just used as a closing component at the end. The
Maybe
idea
it wakes them up a little bit.
wakes up the area, maybe re-energizes it, kind of gets everything firing. So sometimes the massage is done all in prone, and then maybe they'll do a tapotment and rocking effect to just close, even working in that position, and then reposition the client. So time and place for everything.
This client's head,
Just got decapitated.
it did. So there it is. You know, I'm not going to use every single one of these
Mm-hmm.
here, but I might on the back.
Right.
So hold,
Mm-hmm.
get my intention and my focus, and then my compression, maybe a little glide,
Mm-hmm.
a little hard,
To do the
the kneading, the torsion, rocking, maybe to the whole jointed area.
Mm-hmm.
Kind of hard to shake the tissues of the head,
Right.
though. Maybe some tapping, maybe some tapotment
Mhm.
there.
You've even seen that in aesthetics.
You
some
know,
like that.
so you pick and choose.
And this all does include, we have the final method here, which you're seeing, it's listed as just movement. But you see that all of this creates some level of movement. So what do we mean by that?
Well, we're gonna have to do a whole clip on movement.
Okay.
But it has to do with all of the joints being moved through their normal range during the massage.
And to introduce a concept, one of the best phrases that she has taught and uses is this idea of mimic normal. And for a client's body, when we're introducing stressors to this body to try to affect it in a positive therapeutic way, one of the best things we can do for them is just by moving them as though if they could or would on their own. It's one of the benefits of just doing a regular aerobic movement.
Yes.
Doesn't matter if it maybe is more of a experience like Tai Chi or yoga, martial arts, a sport. Anytime we do these things, one of the reasons why they're so beneficial for us is they move every joint of our body. So us during massage, if we move the joints of their body, we're getting a lot of value.
Well, and so I'll just move the arm here. And so the elbow, because I think more about movement than I do individual muscles. So the first movement is more of an assessment. So I want to take it from its neutral position. I want to take it through its full range. I want to know about what that is. And that's an assessment. I might ask you to move it.
And that would be an additional assessment.
Then I might rotate it. Not the elbow joint itself, but there's supination and pronation that happens in there. I can turn this into even kind of a muscle test. I can say, can you go ahead and push against my, all right, and then hold it right there, and I'll pull it, see if we got good recruitment of the muscle. I get down to the wrist. Now I have to understand how a wrist moves. I have to understand the joints and the bones in there. And then I get to the carpals and understand that they move in there. And then down into the joints here. And I want to move them with every single.
And as you can see, this is where it can be a method that is just included in the session. But again, when you go deeper into this, particularly in relation to assessment, then it comes down to your awareness of the body. You mentioned the shape of the bones and the joint structures. We can be asking the question, is this optimal?
Yes.
Is it not optimal? And if not, what is the movement that is not optimal? And then we can start piecing together the puzzle.
Yeah, and is things too much?
I'll go this way around.
Is it too much? Is it not enough? Is it even? Is it painful? Is it not? So movement at the joints and movement of the tissues, that's kind of the essence of what we're doing. So there are your methods.